Cequa utilizes an innovative NCELL technology to deliver cyclosporine molecules to the ocular surface tissues. This technology consists of very small molecules called nanomicelles, measuring an average of 22 nanometers each. The nanomicelles are composed of polymers with a hydrophobic core, which encapsulates hydrophobic cyclosporine molecules and is surrounded by a hydrophilic outer layer. The NCELL formula allows Cequa to overcome the challenge of transporting cyclosporine through an aqueous tear film. Cyclosporine molecules remain protected in the hydrophobic core until after Cequa has penetrated the aqueous tear film and arrived at the ocular surface. The NCELL formula improves cyclosporine delivery and bioavailability by increasing the aqueous solubility of cyclosporine tenfold, improving ocular surface penetration due to the small size and mucoadhesive property of the nanomicelle polymers, and increasing the ocular tissue concentration of cyclosporine. Cequa offers the highest FDA-approved concentration of cyclosporine. It is also the first and only FDA-approved treatment to combine cyclosporine with NCELL technology. The primary endpoint in the phase 3 double-masked study for Cequa was the proportion of eyes with a clinically meaningful improvement at day 84 in unanesthetized Schirmer's test scores. Clinically meaningful improvement in Schirmer's test scores was defined as an increase of 10 millimeters or greater from baseline. The primary endpoint was met as randomized patients receiving Cequa demonstrated statistically significant improvement in their Schirmer test scores when compared with the vehicle group. 16.6% of eyes receiving Cequa achieved a 10 millimeter or more increase in Schirmer score from baseline versus only 9.2% of the eyes receiving vehicle. The most common adverse reactions reported in greater than 5% of subjects were pain on installation of the drops in 22% and conjunctival hyperemia, 6%. Other adverse reactions reported in 1 to 5% of the patients were blepharitis, eye irritation, headache, and urinary tract infection. Yes, the secondary endpoints included mean change from baseline in Schirmer test scores, total conjunctival lissamine staining, central corneal fluorescein staining, complete clearing of central corneal staining, clearing of temporal conjunctival staining, and global patient-reported symptom scores. At day 28, statistically significant improvements were seen in the Cequa group as compared with the vehicle group for reduced total corneal fluorescein staining, reduced central corneal fluorescein staining, greater percentage of eyes with complete clearing of central corneal staining, in other words, a staining score of 0. And this trend continued with added improvements in Cequa patients at days 56 and 84. Reduced total and central corneal fluorescein staining, greater percentage of eyes with complete clearing of central cornea, significantly greater improvement in total conjunctival lissamine staining of the Cequa group compared with the vehicle group. Mean values for the patient-reported global symptom scores were improved by about 30% from baseline at day 84 for both Cequa and the vehicle groups, although without statistically significant difference at any post-treatment visit. This result is not unexpected, as the clinical signs of dry eye disease often do not correlate to the patient's symptoms. Cequa has given my patients relief from their dry eyes by increasing their tear production and improving the integrity of their corneal surface. Patients can obtain clinical improvements in their dry eyes as early as 1 month, which may result from the higher ocular tissue concentration of cyclosporine when delivered by NCELL technology. To avoid the potential for injury and contamination, patients should not touch the vial tip to the eye or other surfaces. The most commonly reported ocular side effect was pain on installation of the drops, which was described as mild stinging and/or burning for several minutes following each installation. This occurred in 24.2% of the Cequa group versus 4.3% of the vehicle group. However, more than 95% of the patients experienced either no or mild burning and stinging. Only 4% reported either moderate or severe burning or stinging. This is shown in the low number of discontinuations for Cequa due to ocular side effects. Only 3.2% of patients in the Cequa group versus 1.1% of patients in the vehicle group.